together with significant investment in these new ways of working, including a £14.1 billion funding boost to health and social care, as set out in the autumn statement. Today's announcement is the second of 3 plans to cut waiting times in the NHS. Our elective recovery plan is already in action, virtually eliminating the backlog of 2-year waits in England. And our primary care recovery plan will be published in the next few weeks to support the vital front door to the NHS through primary care. And today, together with NHS England, we are setting out our plans to reduce waiting times in urgent and emergency care through an increased focus on demand management before patients get to hospital and greater support to enable patients to leave hospital more quickly. That will be through care at home or in the community, supported with a clinical safety net. And in addition, this plan sets out how we will adopt best practice within hospitals, learning from those trusts that have displayed the greatest resilience in meeting the heightened pressures this winter. Mr. Speaker, today's announcement on urgent and emergency care does not sit in isolation. It is part of a longer-term improvement plan building on the legislative change enacted last year to better integrate health and social care through the 42 integrated care boards. Those became operational in July last year. This in turn was prioritised for additional funding through the £14.1 billion announced for health and social care in the autumn statement. Now, following the spike in flu cases over Christmas, with inpatient flu case admissions 100 times that of the previous year, and that spike having extremely quickly a 7-fold increase into December, we announced £250 million of immediate funding on the 9th of January for the pressures this winter, giving extra capacity to the emergency departments to tackle those patients fit to leave hospital who are delayed from doing so. Today's plan, developed in partnership with NHS England and social care partners, builds on those actions and that investment as they set out to the House earlier this month, as we put in place the more substantive changes required to enable the NHS to have greater resilience this time next year. To do so, this plan involves embracing technology and new ways of working to transform how patients access care before and after being in hospital. That in turn will help break the cycle of emergency departments in particular coming under significant strain in winter. Mr. Speaker, our plan has a number of commitments that are both ambitious and credible. First, we are committed to year-on-year improvement in A&E waiting times. By next March, we want 76% of patients to be seen within 4 hours. In the year after, we will bring waiting times towards pre-pandemic levels. Our second ambition, Mr. Speaker, is to improve ambulance response times, with a specific commitment to bring Category 2 response times, those emergency calls including for heart attacks and strokes, to an average of 30 minutes by next March. And again, in the following year, we will work to bring ambulance response times towards pre-pandemic levels. I'm pleased the College of Paramedics has welcomed the plan, saying, quote, "It is pleased to see a strong focus in the recovery of those people in the Category 2 cohort." And of course, this will not be the limit of our ambition, but it is vital we get these first steps right and that we're credible as well as ambitious. To put these targets in context, achieving both would represent one of the fastest and largest sustained improvements in the history of the NHS. Underpinning these promises, Mr. Speaker, is one more essential commitment, a commitment to better data and greater transparency. On data, the best performing hospitals have benefited from the introduction of patient control centres to quickly identify blockages in a patient's journey, and e-bed management systems to speed up the availability of beds when they become free. Through this plan, we will prioritise investment in improving system-wide data, both within the integrated care boards and on an individual trust and hospital site basis. This will allow quicker escalation when issues arise and a better system-wide response when individual sites face specific challenges. On greater transparency, For some time, voices across the NHS have called for the number of 12-hour waits from the time of arrival in A&E to be published, something I know the Royal College of Emergency Medicine has long campaigned for, and I can see the Honourable Lady nodding her head. And indeed, there has been criticism, including from the benches opposite, of the government for refusing to provide this transparency. Instead, the data published to date has been a measure of 12 hours from the point of admission and not arrival in A&E. Mr. Speaker, for the commitment to transparency to be meaningful, we must be prepared to publish data even when that transparency will bring challenges. And so today I can inform the House that from April we will publish the number of 12-hour waits from the time of arrival. Dr. Adrian Boyle, President of the Royal College of Emergency Medicine, previously said, and I quote, "The full publication of this data will be an immensely positive step that could be the catalyst for transformation of the urgent and emergency care pathway that should help to improve the quality of care for patients." And I hope it is a transparency that is welcomed across the House. Mr. Speaker, our plan focuses on 5 areas: setting out increased capacity in urgent and emergency care, growing the workforce, speeding up discharge, expanding and better joining up new services in the community, and making it easier for people to access the right care. Action in each area is based on evidence and experience, learning lessons from the pandemic and building on what we know can work. More than that, we're backing our plan with the funds we need, and the government is committed to additional targeted funding to boost capacity in acute services and the wider system. That is why, Mr. Speaker, this package includes £1 billion of dedicated funding to support hospital capacity, building on the £500 million we provided over this winter to support local areas to increase their overall health and social care capacity. Taken together, Mr. Speaker, this plan will cut urgent and emergency care waiting times. It will do so, firstly, by increasing capacity with 800 new ambulances on the road, of which 100 are new specialised mental health ambulances. This comes together with funding to support 5,000 new hospital beds as part of the permanent bed base for next winter. Secondly, by growing and supporting the workforce, and we are on track to deliver on our manifesto commitment to recruit over 50,000 nurses, with over 30,000 recruited since 2019. And the NHS will publish its long-term workforce plan this year. We're also boosting capacity and staff in social care, supported by investment of up to £2.8 billion next year and £4.7 billion the year after. Thirdly, by speeding up discharge of patients who are ready to leave hospital, including freeing up more beds with a full rollout of integrated care transfer hubs, like the kind of successful approach I saw this morning at the University Hospital of North Tees. Fourthly, by expanding and better connecting new services in the community, like joined-up care for the frail elderly. This includes a new fall service, so more elderly people can be treated without needing admission to hospital. Virtual wards are also showing the way forward for hospital care at home, with a growing base of evidence showing that virtual wards are a safe and efficient alternative to being in hospital. Our aim is to have up to 50,000 people a month being supported away from hospitals in high-tech virtual wards, of the sort that Watford General Hospital has been pioneering, which I saw last month. Finally, Mr. Speaker, we're improving patients' experience by making it easier to access the right care, including a better experience with NHS 111 and better advice at the front door of A&E, so patients are triaged to the right point within the hospital without always needing to go through the emergency department, as is currently the case at Maidstone Hospital, as I saw earlier this month. These are just some of the practical improvements already being delivered in a small number of trusts, which through this plan we will adopt more widely across the NHS, and in doing so deliver the greater resilience ahead of next winter. Mr. Speaker, I'm pleased that NHS Providers has welcomed today's plan, and that the Royal College of Emergency Medicine has called it, and I quote, a welcome and significant step on the road to recovery. Taken together with all the other vital work happening across health and care, including our plans to cut elective and primary care waiting times, today's plan will enable better care in the community and at home, and for that care to be more integrated with services in hospitals and for existing practice to be more widely adopted. I commend this statement to the House.